With all of the talk about healthcare reform, some people lose sight of the fact that there are actually some provisions that will go into effect in this year, in 2010. And I read a pretty interesting article in Kaiser Health News about some of the ones that are going into effect this year that are a little less known than others. For example, they're going to eliminate co-payments for certain types of screenings. You know, breast cancer screening every 2 years, cholesterol screening. Most of this is effective September 23rd, but check with your health plan to see what's covered. There's also going to be something called a retiree reinsurance program to help employers handle the cost of health care retirees not eligible for Medicare. That one's a little fuzzy on my part, and I think it's a temporary fix with limited funding at best, but nonetheless, it could be a benefit to some people. There are also going to be some agencies set up to keep tabs on insurance premiums. They've been talking about that a lot, actually. And then there's certain Medicaid eligibilities that will kick in 2014, while they're actually giving states incentive to make that happen sooner, and states will be funded for that. And then finally, there's something called dual eligibles. These are people who are on Medicaid and Medicare, okay? And usually they're poor and elderly. And a lot of the problem with the care for those folks is the coordination. And so they're going to be investing more dollars into the care coordination for people who are on Medicaid and Medicare. So you might want to look into some of these issues because they might actually affect you personally before the end of the year. Thanks.